That is our signature tune that says Ondiro's mic is off and your voice is on. Where do we start tonight on the show? Now, we did a poll and we asked you, do you think the government's health insurance is reliable? Why and how? 18% of you said yes, but a majority, 82%, said no. So let's just delve into some of your reactions and find out why you were saying yes and why you're saying no. This is Instagram at Lugan Ann says, no, to some, the 500 bob is affordable. To others, it's not. They should create packages that cater for everybody, cannot be one size fits all. Very briefly, 30 seconds. Some Kenyans cannot afford that 500 shillings.
Yes. The economic situation is very bad in the country, and you do not expect that everyone else, especially those in the informal sector, that they get 500 every day and they need to pay. No. They have other competing interests. They have children to take to school, they have food to buy, they need to pay rent. And so it becomes a bit difficult if you ask somebody to pay 500 bob every day. And you heard what one of them said, that, you see, look, I can't be paying 500 every month and I don't get sick every month. So there need to be a lot of education to also people even understand why they need to, contribute to a package.
Okay.
But I agree with whoever, Lugan, I agree with her that there must be packages so that then we demarcate packages and say there's no one side that fits everyone.
Yeah.
We need to make sure that everyone is included in the packages that we present.
Them best. Yes. Let's take a look at another. At Ocasio Mena says, no, it's not. Even the new UHC will just fail like NHIF is. Too many scandals, wamekula pesa yote, hata hawawezi insure people. Okay? Let's take a look at another reaction. At Leroy says, yes, it goes a long way in case of medical emergencies. You can fall ill and the card will help you before you can get some money to cater for other needs. This is in agreement. Let's take a look at another comment. At Linda Mtoba says, hey, hiyo hata ni swali, my friend, lazo hospitali, upigwe na bili over 100K ndo utajua bed cover ya NHIF uokolea. Your 2 cents?
I know there are those who have benefited from NHIF.
Yes.
But remember, a bigger chunk of Kenyans are not. You saw from the poll that up to around 51% of Kenyans have no any form of insurance.
Yes.
And so when you realize that most of them are referring to NHIF, they're referring to themselves because they are covered by NHIF.
Yes.
So it is expensive, especially even for those who do not have it.
Yeah.
So if you have it and you benefit up to 100K, then you are lucky. But then the problem is that it is not inclusive.
Yeah.
There are those who cannot access it. And so maybe then we need to go back and relook at our NHIF and say then, because it's a pool,
it should be benefiting
every single
Kenyan. Okay,
every single
I hear
Kenyan.
you. Let's take a look at another. At Jerusha Ominda says, no. The purpose, let's say, of a cover like UHC is to ensure access for all without financial turmoil. As it is, there aren't enough facilities for access, and many Kenyans cannot afford care. There are so many things the government needs to put in order before it thinks of a UHC rollout. And this is something you mentioned.
Ominde has a very powerful statement, and that's exactly what we are saying. Go back to the basics. I mean, put up enough facilities, equip them, get enough number of doctors and nurses, right? Ensure our procurement process are effective and operational. Ensure our drugs are of quality, and then let people come to hospitals.
Okay.
So that then you go to hospital, you take 2 hours, you are back at home, and you got the best services that you wanted.
I hear you.
I agree with him. Absolutely, yes.
Let's go to another. At Machiavelli says, in other parts of the world, healthcare is free. If we cut down on corruption, we will be able to save enough to ensure quality healthcare at literally no cost. A healthy nation is a working nation.
I think in Kenya, the issue of corruption can never be under mentioned. Like we all know there is a problem with corruption, and even in the health sector there is a lot of it. I agree with him. If we are able to combat in a way the flow of money and where these monies go, then we should be able to convert the funds that we lose into strengthening our healthcare systems and being able to provide the best quality of services that Kenyans want. Okay.
Yeah. Now we want to move on to WhatsApp because we're tight for time. You guys have sent us a lot of feedback and we cannot sample of it. We're just sampling some of it, but we'll always be online to keep this conversation going. So JJ Bali says, no, get sick, then wataanza kukwambia, oh, sijui, haijakava hii, haijakava ile. Kenyan government doesn't know what reliable is.
I think it goes back to what I was saying. You'd not just come up with packages and you don't involve Kenyans who are supposed to be contributing to that pool,
Yes.
but also beneficiaries of the services. So you develop your own package in the wherever you develop it, then bring it to Kenyans.
Textbook economics does not work on the ground.
Exactly. That is the thing. That is the thing. So you must involve them first.
Okay, let's take a look at another. At Beryl Wanje says, no, what is reliable? When the services in government hospitals have poor services, na hata hakunanga dawa, goes back to the point you were saying.
Yes.
Let's take a look at another. Says Lillian Gelly says, yes, I have used the card since 2016 and it has gone a long way in covering both my family and I. Good for you, Lillian. Let's take a look at another. At Domiana Were says, yes and no. Inasaidia kiasi. However, the cover is not as comprehensive as it should be, comprehensive. It should be expanded to cater for things like optical, dental, and others. Imagine that Mama Boga who has no money to go to a good optical hospital or a dentist. Also, in terms of packages, ensure they're comprehensive to cover every single person.
Absolutely. We need to go back and redefine the packages. But most importantly, involve those who are supposed to be benefiting from these packages. I mean, when you go take people and sit them in a hotel somewhere, you know, at the highest level and ask them to develop packages, they do not know what people at the grassroots are suffering from.
Yeah.
They have no idea of our economic status. They do not know the kind of diseases. In fact, by the time they're developing their packages, they do not even know the disease burden that we have. So I think there is a lot that needs to be done, but essentially involve those who are supposed to be benefiting from these services. Yeah.
Okay, at Pendo Mwendwa says, no. Does the government use these covers? They have private insurance, hence hawajui kiatu inatufinyia wapi.
I like that. And in fact, one of the things we are complaining about is the fact that my card, my NHIF card, and somebody else who is working in government NHIF card covers different, you know, packages, even though we are in the same bracket of a job group. It's horrible. It's the highest level of exclusivity that I've never seen, inequality, you know. And we need to address that so that then everyone is able to access the same kind of services, you know, within the same kind of job group, for example. Yeah.
Now, this is a very emotive topic. We are even seeing Kenyans just expressing themselves online, and this is just some of the feedback. It's overwhelming. We cannot go through all of it at a go. But from everything that you've gathered, what would be your takeaway point for Kenyans and for the government in relation to ensuring a proper medical insurance system that works both for Kenya and for Kenyans?
Thank you. One
camera two.
Okay, camera two. This. Thank you. Kenyans must be able to hold their government to account for the kind of decisions and actions they take in regards to their access to health.
Okay.
The level of money, the amount of money that we lose as Kenyans through health is a lot, and we are always quiet. So first, let's be able to hold our government to account, especially the county governments that are now in charge of, you know, healthcare delivery at the county level. Secondly, it is important that we develop a system that works for all of us. And this is only possible if everyone who is working in the health sector is involved in making those decisions that affect our daily lives in terms of our health. Okay. So let's ensure that we involve everyone so that then we make decisions that address the issues that all of us have. Thirdly, let's sort of move away from talking about capacity issues, you know, capacity as an issue, and then essentially talk about capacity as a deficit, in the sense that we need to address governance issues in the sector that then will help us address the nitty-gritties in the sector, like, you know, the strikes, the lack of medicines. Those are simply governance issues. It's not about capacity. So as a government, let's go back and focus on, you know, addressing the capacity deficits, the governance deficits, sorry, that we have, as opposed to looking at it as a capacity deficit. Lastly, but very important, is that a healthcare system can only work if it has enough resources. So let's allocate enough resources to allow us to implement the kind of project that we put across as a government, but also importantly be able to also account for the monies that we are given by the Kenyans to implement some of these projects. So in so thinking, then we should be able to develop an effective, efficient, and robust healthcare system that takes care of the needs of every Kenyan, regardless of your economic status, regardless of your social status, and by the fact that the Constitution actually looks at you as a Kenyan and who deserves to be, you know, given healthcare rights across board.
Thank you.
Thank you.
Wow. Such an interesting conversation we've
Yes,
had, and it doesn't stop here. It continues online.
Absolutely.
The questions,
absolutely.
the thoughts, the comments, and we hope that this is a conversation that we can keep having. It's not a destination, it's a journey.
Yes.
Thank you very much, Collins, for making time.
Thank
and we
you
hope
very much.
2022 or even sooner, when the national rollout is done, you can come back and we can still have this conversation.
Yes, we should have it every day.
Yeah.
No problem.
Thank you
There's no
very
problem.
much.
Thank you very much.
Now, in 1980, India made a conscious decision and created their Big Five. And every leader that has come into office since 1980 has stuck to that same blueprint. Among the top priorities was a healthy nation and a functional health system. Fast forward, 39 years later, India is one of the world's leading health destinations. We know Kenyan leaders that have gone to India to seek medical attention. Let's not even pretend. In 2017, our president launched his Big Four agenda. It looks good, but it has to be rolled out in 2022. You tell me, is it a legacy project or a lifetime project for this country? Hashtag at Metropol Debrief at Odiro Ganga. Have a good evening.